So, hello everyone, welcome back to my channel. And today's topic is diabetes, where we'll be understanding the basics of diabetes. So, welcome to Learn with Bibo. And previously, I shared a video on cholesterol metabolism, majorly the dietary cholesterol metabolism, which you can check it out. Link will be mentioned. So let's get started with today's video of understanding the basics of diabetes, why diabetes occurs, and why it is a major threat in today's world, and why you know, most of the human beings are suffering from diabetes. So let's get started. Um, okay. Well, according to a study published in the Lancet Diabetes and Endocrinology, 11.4% of India's population are living with diabetes. And when it comes to the world statistics, 10.5% of the world's adult population aged 20 to 79 years old are living with diabetes. The major symptoms of diabetes include increased thirst, feeling thirsty most of the times, then frequent urination, hunger, fatigue, blurred vision. So these are the common symptoms in both type 1 and type 2 diabetes. Pre-diabetic people usually do not have noticeable symptoms. So yes, let's get started. Coming to the types of diabetes, there is type 1 diabetes. So type 1 diabetes is an inbuilt type disorder. That is, it is an innate disorder, which is called as an autoimmune disorder. That is, by birth, this thing is present. So the baby is born with diabetes. And when the immune system destroys its own cell, which is the meaning of autoimmune disorder, the pancreas cannot produce enough insulin to break down glucose. Hence, there is spike in glucose levels, and this is type 1 diabetes. Now, coming to type 2 diabetes. Type 2 diabetes is not by birth, but it develops in the later stages of life in a human being, which might be due to several factors, um, like genetics or lifestyle, etc. And in this, there is no proper, there is no sufficient production of insulin by the beta cells of the pancreas, or there are two conditions in this type 2 diabetes. Either there is no sufficient insulin production, or the insulin is not efficient enough to break down glucose in the body, which results in spike of glucose in the bloodstream. Now, coming to the third type, this is gestational diabetes. Gestational diabetes basically is a type of diabetes that occurs in pregnant women. So during pregnancy, gestational diabetes might occur, which might be due to various factors again, hormonal changes or different conditions, majorly hormonal changes, which make insulin less effective. Hence, there is no proper breakdown of glucose in the body of pregnant women, and it results in gestational diabetes. Now, coming to type 1 diabetes, how it actually takes place, how it is an innate disorder. So, it is an autoimmune disorder where now this is the pancreas. We all know it is a leaf-like structure, right? So, pancreas have specialized cells called beta cells, which release the hormone insulin. So insulin is an hormone which is released by the beta cells, which are specialized cells of pancreas. This insulin, the function of insulin is to break down glucose and convert it into glycogen, store it in liver, so that we can utilize it for, it basically fuels our energy so that we can utilize it for our day-to-day activities. It provides energy to our body. Now this is glucose. Now this insulin helps break down helps convert glucose to glycogen, which is stored in liver. So, necessary amount of glucose which is required in the body is utilized, and then the remaining is converted into glycogen and stored in the liver, so that in future, whenever there is a need of glucose, this glycogen again converts back to glucose, and then it is utilized for specific functions in the body. Now, coming to glycogen. So this glycogen is basically stored in liver. The glucose is converted to glycogen, as I previously mentioned. Now, this glycogen again converts back to glucose whenever in need, so that there are two types of process taking place. One is glycogenesis, another one is glycogenolysis. So glycogenesis is conversion of glucose to glycogen and storing it in liver, basically production of glycogen. And glycogenolysis, the word lysis, which means breaking the glycogen to glucose whenever needed in future by the body. Now, it is an autoimmune disorder, as previously mentioned. So what happens is the beta cells of pancreas basically become evil to themselves. That is, they self-hurt, they self-destroy themselves, and then there is no insulin production due to that. Now, the beta cells basically destroy themselves. The cells destroy its own, and it results in destruction of beta cells. So when beta cells are not there, then definitely there is no production of insulin, which results in spike in blood glucose levels, right? So this is how basically type 1 diabetes, the reason for type 1 diabetes uh, occurs, the cause of type 1 diabetes. It is an autoimmune disorder. So it is an inbuilt function where the beta cells basically destroy its own, and there is then no production of insulin. Now coming to the factors which affect type 2 diabetes. So type 2 diabetes, as I previously mentioned, occurs during the life stages. So it is not inbuilt, it is not, the baby is inborn with type 2 diabetes, but it can occur in later stages of life. And these are some of the factors which might be responsible to cause type 2 diabetes. The first one is obesity. Obesity is a major cause of type 2 diabetes. And most of the diabetic patients in the world are basically obese. Hence, it is one of the major factors or causes of type 2 diabetes. Second one is genetics. So if a patient is having any family history, then type 2 diabetes might occur. Third one is age. So it is a risk factor, age risk factor, where people are above 40 and above, they are more prone to type 2 diabetes. Then definitely lifestyle. Some of the lifestyle conditions are not getting enough exercise, smoking, stress. Stress also plays a major role in causing type 2 diabetes. So it's advisable to just let it flow and not take much stress because yes, your life is important, so you shouldn't be taking too much of stress. And then excess sleeping. So bad sleeping habits like excess sleeping, then alcohol consumption, then depression. Depression is a mental health condition, hence it is also reported as one of the factors which might be responsible for type 2 diabetes. Then definitely hormonal conditions. So hormonal conditions, for example, women with PCOS are more prone to type 2 diabetes. So they are advised to consume less sugar in their diet. Now, coming to type 2 diabetes. So here, as I already mentioned, that type 2 diabetes either make the insulin inefficient, like not efficient enough, to break down the glucose, proper breakdown of glucose, or it is not sufficient. So insulin is produced, but it either is not efficient or not sufficient. So remember the two terms, efficient, sufficient, right? And then definitely it results in the spike of glucose in the bloodstream. And then it prevents this increase in glucose in the bloodstream, prevents glucose from entering the other organs. So other organs cannot utilize glucose for the specific functions. And it hence results in other organ damages like kidneys, liver damage, etc. Now, coming to the insulin, there is insufficient insulin, right? And this insufficient insulin does not break down glucose, which results in excess of glucose in the bloodstream. And the other organs basically do not receive glucose. And here is the type 2 diabetes range. So the blood sugar level, if it is 200 mg per dl or more after 2 hours of food consumption, when it is tested, it suggests that it is type 2 diabetes. The pre-diabetic range is around 140 mg per dl to 199 mg per dl. So pre-diabetes is an indication that will lead to type 2 diabetes. So it's better to take prevention because prevention is better than cure. And then coming to type 2 diabetes mellitus pathophysiology. As previously mentioned, there are insulin receptors on cell surfaces which become resistant to insulin. So there is not enough amount of insulin produced, which then prevents the beta cells get damaged, right, or decrease, and there is a decrease in the insulin secretion, which results in insufficient insulin production. Then there is no sufficient insulin to break down glucose, hence there is spike in blood glucose level, right? This is how the type 2 diabetes mellitus mechanism works. Now, the drugs which are used to treat diabetes, the most commonly used one is most commonly prescribed drug is metformin 500 mg. It works by decreasing gluconeogenesis. So gluconeogenesis is production of glucose from other sources, right? So it produces glucose from the non-carbohydrate sources like amino acids, fats, glycerol, etc. So basically, metformin 500 mg has the function to decrease the sources of glucose. Like it decreases the production of glucose because there is not enough insulin produced in the body. So hence there is less glucose produced due to the drug, and the insulin produced might be sufficient to break down the glucose, the little glucose which enters the body. The next one is sulfonylureas. Examples include glycopyride, limepiride, clopropamide, etc. This increases the production of insulin from pancreas. So basically, this drug induces the beta cells of pancreas to produce more insulin because there is not sufficient insulin produced. Hence, more insulin is produced due to the drug, which helps in the breakdown of glucose and lowering the blood sugar levels. Then the third one is meglitinides. Example, right? So these are the drugs basically which are used to treat diabetes, both type 1 and type 2. They are prescribed to basically maintain the blood glucose levels in patients. And this is how, or the causes basically of diabetes or sugar patients. So I hope that you guys now have a basic understanding of why there is a blood glucose spike, right? And the causes, what is the difference between type 1 and type 2 diabetes, and what is gestational diabetes, then the drugs. These are few of the drugs. There are many other categories. I mentioned only the few. So this is the basic functions of drugs included as well, like metformin 500 mg decreases gluconeogenesis, then sulfonylureas, increased production of insulin, meglitinides, also help in lowering the blood glucose levels, maintaining it in the normal range, right? So this was a basic understanding of the concept of diabetes. So I hope you guys liked the video and make sure to like, subscribe, and share the video, right? And comment down below on how my explanation was, and I hope it was clear. And I would also like to know any other topics you guys would like me to cover, right? Give a simple understanding related to biochemistry, chemistry, microbiology, anything. So thank you so much, guys, and hope to see you in the next video.